beneficiaries. The other thing that this law is going to do is going to close the Medicare Part D donut hole and make prescription drugs more affordable. There's going to be a $250 rebate this year to Medicare beneficiaries who hit the prescription drug coverage gap. There's already been, I think, over 400,000 $250 checks sent out from the U.S. government to seniors who are in this coverage gap. And it's going to completely close the donut hole by 2020. The way it's going to do that is it's going to reduce the price of name brand pharmaceuticals and also expand coverage, so it's going to kind of shrink that hole. So in 2011, 50% price discounts on brand name drugs to low and middle income beneficiaries. Within Medicare, you see major cost containment provisions. There's going to be a crackdown on provider fraud, waste, and abuse. Did any of you see the 60 Minutes story that was called the $60 billion fraud? Unbelievable. $60 billion of fraud happening on the provider side. Most people think on the beneficiary side, but no, on the provider side. They highlighted what was going on in South Florida. You know, think about a major senior population, Tampa South. You had 3 Medicare officials trying to regulate that entire area. That was your first issue. Second issue, what would basically happen is you'd have all these providers who would pay people on the inside of organizations to get the Medicare billing codes, or they'd have somebody on the in the inside steal the billing codes. They would set up these shops with no actual person in it, but they'd have a voicemail, and they would just start billing for all of these things. And you know, you had a case where a judge was literally charged for a prosthetic limb that he had never been an amputee, but Medicare paid that bill. And what would happen is when they'd go to crack down on these places, you know, there was never anyone there, so they would just move to the next storefront and continue to use those same billing codes or get new ones and pay for those. And did any of you see how this affected New Mexico just within the last 2 weeks? They caught, it's insane, they caught 7 people here in New Mexico that were part of, I think, a 50 to 60 person Armenian organized crime ring that they're projecting to be well over $1 billion. In New Mexico, it was, you know, I think something like $100 million of fraud occurring here in New Mexico. If you got organized crime rings stealing from Medicare, you had major issues. And the fact that the provisions of this law have already kicked in to catch these people is enormous. So that is happening right here in our backyard, and this law did a ton to bulk up the information technology as well as bulk up the personnel to crack down on this. The other idea, and people in the hospital industry may be really interested in this, is payments are going to be outcome-based instead of volume-based. There's going to be pilot projects for Medicare to do an outcome-based payment instead of a volume-based. If you think about the way Medicare does billing is, you know, a doctor can order a test and Medicare will pay for it. And they may order the same test and pay for it again. Then they'll send them to a specialist who will order the same test because they don't like that lab, and they may pay for it again. It's a volume-based system. You keep getting paid based on the volume of services you order. You know, that's obviously an oversimplified way of Medicare, but that's kind of what happens. The idea is to make it outcome-based, because what you had is like Cleveland Clinic, Mayo Clinic, they basically threatened to stop taking Medicare. Why? Because they said the guy up the road who's ordering 3 tests, 4 tests, doesn't know what he's doing, sending him to a specialist, sending him back to them, is charging a ton of money to Medicare. They come in here to the Mayo Clinic, we diagnose them, we order the right test, you know, we do what the test tells us we need to do. They get healthy, they're out the door, we get paid half as much as the guy up the street who's made all of these problems. This is not a fair system to us. So Cleveland Clinic and Mayo Clinic were very frustrated with Medicare. There's going to be pilot projects for big clinics like them, hospitals, if they want to move towards a more outcome-based instead of volume-based system, then they can partake in that. There's also going to be a move towards bundled billing instead of itemized billing. Think about the way billing is done right now. You list out every single thing, you know, pre-op, op, post-op, it's all listed there, bedpan to Q-tips to the surgery, all listed out side by side. And as hospital administrators, then you do what? You fight with the insurance company because they're going to say, we're only going to pay you this amount. And you say, no, it costs us this amount. And you go back and forth. It's a tremendous amount of work, a big headache. And then eventually you settle on something and they hopefully will cut you the check in a reasonable amount of time. The idea is to say, we're going to do a bundled billing system. This is another thing that a lot of the cutting-edge hospitals, a lot of the cutting-edge providers really like, because they're saying, we'll pay you, say, $25,000 for hip surgery. You have all of these standards of care, you know, that have been set. You have to meet those standards of care. But if you can do it more efficiently for $20,000 or $14,000, you just made an enormous profit. And you don't have to haggle with all that administration. So the most efficient providers, the providers that are doing the best care, love these kind of ideas. These are pilot projects to see how they're going to work in reality. But that's one of the things you see in Medicare. The other thing is there's the MedPAC Advisory Group. It's a formal congressional group that advises Congress on what changes should be made with regard to Medicare in terms of quality as well as in terms of cost containment. Senator Bingham is a huge fan of this MedPAC Advisory Group. They have a lot of good recommendations. Congress has never followed them. So what does this law do? It requires Congress to act and follow them or come up with alternative solutions on the exact problems. They cannot just not act, which is huge.